Well, I sought out services with Dawn because I had been in physical therapy at a physical therapy center post-stroke. And at a certain point, I was told to just go home and practice my exercises. And that was about a year and a half ago, I think. And I knew that I had more to do, especially with occupational therapy. And I knew Dawn from earlier years when I had physical therapy for post-knee surgery. So I called her and talked to her, and she happily was setting up her own business. And she now comes to my house along with Jacqueline Scully, and I get absolutely top-notch physical therapy here. So, and I'm happy, post-stroke, I've not been driving yet, so that was an added convenience having them come to the house. And it's just worked out beautifully for me. When I got home from the hospital, I had to learn to walk again. I had a monster lymphedema in my left arm and hand. I had things going on that needed help and correction. So they came and started working with me very patiently. My stroke was 3 years ago, and I can now walk fairly well. My balance is greatly improved. The last vestige of the stroke is what's going on with my left arm and hand, and they continue to work with me. And the progress, it's strange. The post-stroke progress with therapy is very, in my estimation, kind of unpredictable. It's not like the healing post-knee replacement. It's not as from point A to point B. It kind of zigzags all over the place. And the benefit of working with Dawn and Jacqueline is that they're both so bright and innovative, and they both keep up with all of the currents with physical therapy and rehab. And, we've come up with some amazing ways to get my body to do things that I thought I wouldn't be able to do before. I continue to have incremental improvement. I don't know what the end will be, but we're working at it. Not to knock other settings, but when I was in the formal physical therapy setting, I will not mention which one, but we seemed to spend a good half of the time that I was allotted there with the therapist having to be entering things on a computer. When I got out of the hospital and I had other visiting therapists, it was the same thing. They'd come and I was supposed to get a 45-minute session, and they'd show up and they would sit with the computer on their laps, and we did, the therapist was doing input for a lot of the time, and it just wasn't a very good setup. So I decided, this is working well for me, and I'm going to continue as long as I am making improvement and they don't get tired of me. And I absolutely have referred and will continue to refer. I've given their names to a couple of physicians, my internist, who in particular had a post-stroke patient that was having problems getting good, what she perceived to be good therapy going. So yeah, absolutely, they're wonderful. They're just wonderful.